G'day everyone, welcome back to the channel. So today what I'd like to talk about is, I want to talk to you guys about why your aches and pains aren't age related. Now I want to be very respectful to the people that feel like their aches and pains are age related, because on the surface it can absolutely feel that way. For most people, you've gone through your life and then suddenly as you start to get a little bit older and older and older, you can start to pick up on some aches and pains that you didn't have before, whether that's some neck pain, some back pain, knee pain, shoulder pain, whatever it is. The bottom line is that things don't feel as fantastic and comfortable as they did when you were younger. So we get this idea that those aches and pains are based on you getting a bit older. And hopefully by the end of this video, you'll come away with a really, really good understanding of why that isn't necessarily the case, and why there's a whole broader aspect, a whole broader perspective to this conversation that we often don't necessarily realize, which is really powerful, because traditionally, if you're someone who does feel like your aches and pains are age related, it often is associated with these ideas that they can't get better, or that you can't do anything to make them feel better, because if they are age related, you can't de-age yourself, you can't wind back the clock, so therefore those problems are either going to stay the same or get worse, depending on a whole range of luck and maybe some other factors as well. So what I want to go through in today's video is, I want to talk to you guys a little bit about what that idea is in its entirety. I want to talk about what it actually is and give you guys some clues as to why your knee hurts all of a sudden, why your back hurts all of a sudden. And then more importantly, towards the end of this video, we want to make sure that you've got a really good understanding about what you can start to do and start to implement to feel like you're winding back that clock to make sure that those aches and pains start to feel better, despite the fact that you're consistently getting older. So before we get into it, let me know in the comments, what are you dealing with? Do you have a sore back at the moment? What's brought you to find this video? Is it your knee that you're interested in? Is it your neck that you're interested in? I'll talk about the concept of age-related pain more so in regards to knee pain and back pain, because they're the most common things we sort of see day to day clinically. But let me know in the comments below what you're dealing with, and we can have a talk about how to sort of morph this conversation to meet your specific needs. And as always, if you go on to like the video, if you enjoy the video, if you find it useful, please consider leaving a like below to let us know, and also consider subscribing to the channel just so that these videos can get out to more people. Obviously, the more support we get, the more people that end up seeing it. So let's get into it. So I guess the idea of age-related pain makes perfect sense, and I think it's one of the reasons why it's an idea that's been perpetuated for a long time, despite it not necessarily being true. And I think the reason why it feels that way, as I said before, is that for a long time, you go about your day-to-day life without any real aches and pains, and then for a lot of people, just gradually out of nowhere, things start to hurt. They don't feel as great as they used to. Maybe your back feels a little bit sorer, maybe it feels a little bit stiffer in the mornings, maybe your knee, maybe you're starting to pick up on a little bit of arthritis type pain, it doesn't feel very nice in the mornings, or you go for your regular exercise and maybe going up and down the stairs suddenly doesn't start to feel fantastic. And I think the reason why we've come to blame age isn't because of an abundance of overwhelming information that tells us that age is the problem, but more so because there's an absolute lack of information that tells us that it's a problem, and age is a thing that makes sense to us. It's a factor that we can sort of attribute to these issues, and it tends to make more sense to us. So if your back suddenly starts to get sore, it's not that it was preceded by an obvious incident. Like you didn't twist and bang, your back got sore, you weren't running and you ran up a step again and that knee suddenly started getting sore. It's often just this gradual onset, this really boring, uninteresting, insidious onset of pain and discomfort. And we've been told this over a long period of time, that as we start to get older, our tissue starts to wear, or it's normal for that to happen. And we therefore attribute pain being normal to that as well, which again, it does make sense. So if you're someone who thinks that way, it's completely understandable, but hopefully your mind is open enough to sort of take on board what I'm about to say, because it will hopefully change your perspective on things and give you some hope that you can make some changes and feel better. So I think when we're talking about this idea of age-related pain, I guess one of the important concepts one of the myths we want to dispel here is that I guess there's two things. One, that aging is abnormal, and B, that use is abnormal. Now, if we talk about aging as an idea, aging is obviously normal. We are designed to grow up, get older, and then move on. Same thing with use, where our body is designed for use, it's designed to be used. And somewhere along the lines, we've attributed those two factors to being a reasonable explanation for the onset of your problems, whether it's wear and tear, pain, dysfunction. And then we wrap that up in the moniker or the umbrella term of age-related changes. But those two things are normal. We are designed to age, we are designed to move. So if we talk about aging, there are definitely age-related changes that happen to the body. But the key difference here is that those age-related changes shouldn't necessarily be seen as dysfunctional from a musculoskeletal perspective. So, for example, if you are someone in their mid-30s, mid-40s, mid-50s, it's reasonable to expect that maybe your peak 100-meter sprint time may not be as quick as it was back in your early 20s or late teens. If you are someone who lifts weights, perhaps your peak bench press or your peak squat was in your 20s or 30s, and as you get to 30s, 40s, 50s, 60s, it's reasonable to expect the ceiling of your capacity to drop off. And again, we're talking musculoskeletal changes here. And that they're reasonable changes, but the difference here, and the difference I want to make by sort of recording this video is to say that if you are running that peak 100-meter sprint time when you're 20 years old or 50 years old, you shouldn't expect your back to start hurting in the process. Your capacity may be diminished a little bit. Maybe your endurance isn't as strong. Maybe your strength isn't as good. Maybe your reaction speeds, those sorts of things. Maybe the limits of your capacity may sort of come in a little bit at the edges, but you shouldn't expect tissue to fall apart along the way. And the reason for this ties into the second part of this conversation about use being normal. And we often attribute a lot of our aches and pains to overuse or overuse over time. And again, we want to break this down and talk about this from more of a physiological perspective, because use is obviously normal, but overuse shouldn't be seen as dysfunctional in a perfect world. Because if you're someone who goes to the gym and wants to get stronger, if you're someone who is playing an instrument and wants to get better, repetition is key. You have to do a lot of it to get better at it. You need to lift heavy weights often to tell your muscles and your nervous system that you want to get stronger, and then over time it adapts to that stimulus and gets stronger. If you want to become more skilled at playing the piano or playing the guitar, you've got to keep practicing and practicing and practicing for hours and hours on end. 10,000 hours is potentially one of the milestones we want to hit for skill acquisition. But then we do that because we know that our nervous system and our body adapts to those things and gets better over time. But again, at some point, we've excused injury during those moments as being normal, and that you've overused it, we've done a lot, when in actual fact, we've done too much, when in actual fact, a lot of repetition is the way that the body gets better. So I guess what I want to do here is, with those two conversations, we need to sort of slowly morph into the broader conversation of what's actually going on with your body. Why are you suddenly feeling your aches and pains when you didn't have them before? You've had them now, and you are getting older every day, as everyone is. And I think the key difference here, and we talk about this a lot in these videos, is there's always hidden dysfunction there under the surface. So for example, if you have some back dysfunction that's just suddenly come out of nowhere, generally you would expect there to be some less than perfect postures, maybe some stiff hips, maybe a stiff thoracic spine. There's things below the surface that aren't painful in their own right. So less than perfect posture and loading, so slouching, for example, stiff hips maybe from sitting, stiff upper back from sitting in a bad shape. Stiffness as a rule, or positioning as a rule, doesn't hurt. So by definition, we don't necessarily have our attention drawn to those things. But if they're there under the surface, so if your hips are stiff, your upper back's stiff, your posture's not great, over time, that can start to wear away at your tissues. It can start to set you up for pain and dysfunction, where instead of being at this perfect baseline all the time, if your threshold for pain's up here, as time goes on, you will start to gradually go up and down, up and down, up and down. And depending on the quality of your mechanics and the quality of your shapes and techniques, you may start to breach that threshold for pain and dysfunction. But the really important thing to understand here is it's not time that's the problem. It's time spent doing things abnormally, which is the problem. So if you have a bad knee, we know that a lot of knee pain is the consequence of ankle stiffness, hip dysfunction and potentially low back dysfunction as well, that knee joint is a joint of consequence. And yes, the knee is the joint and the tissue that hurts. Yes, it's the tissue that wears down and shows arthritis on scans, but it's potentially the ankle, the hip, and the back which set that up for dysfunction. So it's not that, again, the knee tissue is designed to fail over time, but if you're doing things improperly or you're walking around with mechanics that aren't perfect, there's a massive handbrake on there, the way you load your knee is different, the longer that goes on for, the more likely you are to experience dysfunction. And the really positive thing about this conversation is if you're able to take a step back, have a look at the way that you load up your tissue and improve the way you load up that tissue, whether it's better posture or better leg mechanics, for example, in the context of these two examples, then you can expect your dysfunction to start to get better, regardless of your age. And it's a really, really powerful statement because we're not waiting for things to happen. We're not hoping that things stay the same or get better. We're actively looking at the way that you load up that dysfunctional tissue and picking out the things that aren't normal, improving the way that those things are loaded, the way they function, so that you can restore normal loading to those tissues again. And I think it's a really important distinction to make in that as we get older, it's not age that starts to catch up with us from an ache and pain perspective. Again, it may start to change in terms of your peak capacity for performance and things like that. But the dysfunctional aspect of your tissues generally is only there if something's left to fester over time. So if it's not left to fester, or if you can go in and see a physical therapist, work on some of the concepts we talk about in these videos, then you should reasonably expect your problems to either flatline and stay the same or get better going forwards, regardless of what's happening with your age. So hopefully that's a useful piece of information for you guys. I guess the overwhelming thing to take away from this video is that your aches and pains aren't age related. They're due to some hidden things that you haven't been aware of, most likely, things that you can become aware of and improve upon to start to make inroads on those aches and pains. Now, if you're someone who is 60, 75 years old, and you've had dysfunctional leg mechanics for the best part of 40 years, clearly there's going to be a consequence attached to that, having had those dysfunctional mechanics for 20, 30, 40, 50 years. Maybe your knee joint now doesn't look perfect anymore. Maybe it looks a bit worn and torn. Maybe there's some arthritis in your back. Maybe there's some dysfunctional tissue there that you've accrued. But again, the positive thing is your aches and pains in context are based upon the poor mechanics and that tissue imperfection. So what you can start to do is if you start to improve the tissue mechanics, the way you load it up, the way that it moves, the quality of the tissue around that area, then you can start to peel back those dysfunctional mechanics. You can start to see what's left over. So it doesn't necessarily mean that at the age of 40, 50, 60, 75 that your knee pain and the arthritis that's shown on the scan have to be paired together forever. Once you improve the mechanics of that knee or the mechanics of that low back, you can start to explore what starts to happen with your aches and pains. And one of the positive things about the body is it always adapts to what you do with it. So as your body starts to upregulate that function that may not have been perfect for a long time, you may start to see some improvements in your aches and pains and effectively de-aging that whole experience. So I think it's really important to take that perspective on board. Obviously, it's important to respect the fact that it feels like it's age related to a lot of people, but I want to make it clear that it's often because we default to that in the absence of more probable information, more sort of information that makes more sense, information that works. And clinically, we know that when we start to improve the way that you load your body up, the way that you load up those dysfunctional tissues, everything upregulates. And it's just a matter of, does that upregulate enough to overcome any structural abnormalities that you've accrued or any tissue issues that you've developed over time. But the exciting thing is you can explore that and no one can tell you otherwise. You can figure this sort of stuff out for yourself. Again, using some of the concepts we've spoken about in these videos. We've got videos on mobilizing your ankles, mobilizing your hips, improving your thoracic mobility, improving your spinal function, what good leg mechanics should look like from a squatting perspective, what good posture is. There's a whole list of videos that we've gone through that you can use to your advantage to start to peel back the layers of I guess, the underlying root cause of your age-related aches and pains. So again, let me know in the comments how you're going. I want to hear how you're going. I want to hear why you've come to watch this video, what it is that you're struggling with. So hopefully we can direct you maybe even make a specific video dedicated to those ideas. We know that if you're having an issue, it's very likely there's a whole bunch of other people that are having the same issues that would benefit from some information on those conditions. So, so again, hopefully this was useful, and we'll catch up with you guys in the next one. Bye.